So this is right where I broke the capsule.
You break a capsule every week around here. Do you want to start filling out the site center forms now, or do you want to wait till retina cleans up your mess? You know, you're not LeBron. You can't just keep dunking lenses.
You can see here, this is a 91-year-old female that had a pretty mature cataract. You know, I thought it was a pretty tough case when we were doing it, and so that's why we used the little trypan blue dye. The wound was okay. Could have been better. Obviously, I did tilt the blade well.
Why are you doing that?
Well,
do you even know what an eye looks like?
Yeah, I'm not sure why I did that.
You ever consider medical cataracts? Optometry school is still open.
You know, I just can't take this anymore.
Get out of here. Who's next?
So in this case, I had a broken capsule. It was very difficult. You know, patient was moving a lot, was claustrophobic, and was deaf, so I had to speak really loud, but he didn't understand what I was saying. So that's what added another challenge. And the nurses started yelling at me.
You gotta remember, you're in charge there. Don't yell at those patients. It's not their fault they got you for a surgeon.
So this is a case I did, and you can see the patient, you know, has a history of trauma, and you can see the zonular dehiscence.
The trauma's not to that patient. That's assault by you. That's not even cataract surgery. What are you doing up there? Well, it looks like you just bought Tang another boat.
Okay, so this is a patient that, as you see, I entered into the eye, and when I started doing the hydrodissection, the lens just literally dropped. I'm not exactly sure what happened.
You're not sure because you never pay attention. You're just in there for fun, aren't you? Where are you doing your fellowship?
Cleveland Clinic.
Cleveland Clinic. Well, UH is in a lot better shape that you're going over there.
Oh, okay. Well, here you can see that the...
Are you yawning back there? Tell me what you did on this case.
Well, you can see I'm starting the case here. It was a fairly routine start.
Are those your hands or your feet? Go on.
Okay, so I started my groove there, and you can see I'm entering the eye at this point. Had a little trouble at that step there, but you know, I'm making progress, and here's where I get into a little bit of trouble.
God, this is a horror movie. Keep going.
You know, I think I'm gonna go fishing instead.
What happened to your Rexes here? I could do a better Rexes with a rusty spoon.
Can't deal with this.
Well, there's always the fellow eye, Danny. Where is everybody? Why doesn't anybody ever bring videos of this conference?
You guys, pick out your roles inside your line.
Yes, this is Dr. Bardenstein.
Hello, Dr. Bardenstein. This is Dr. Simmons from medicine. I was wondering if I could run a consult by you real quickly.
Go ahead.
We had this guy come in with, I came in from an outside hospital. I don't know, got a lot of things going on, but I'm pretty sure he's got boophthalmos. And I was wondering if you guys would could take a look at him sometime in the next maybe 5 or 10 minutes.
When did he come in?
Well, he's been here for about 3 weeks.
Why has no one called me sooner?
Well, you know,
this is 3 weeks now. Why has no one called me sooner?
Well, we just realized that the boophthalmos was present, and
where is the patient at?
He's on 5C.
Okay. We'll come up and see him. What's the last name?
The last name is Vaca.
Okay. I'm going to call my resident, and we'll get this started.
Okay, sir. Thank you.
Okay.
Dr. Bardenstein? Dr. Bardenstein?
Yes, hello, Mariah.
Dr. Bardenstein, did you page me?
No, you paged me.
No, you paged me. Did you
maybe
page me?
Maybe I did page you. Yes, yes. There's a patient on 5C that I want you to see.
Dr. Bardenstein, I think I'm right next to you. Oh,
yes,
I'm
Mariah,
sorry.
there's a patient on 5C. I'm sorry about that. I didn't realize you were there.
Okay.
There's a patient on 5C, last name Vacas.
Oh, I know that patient. It looks really serious, Dr. Bernstein.
How do you already
No,
know
it
about?
looks
How do
really
you know about this patient?
Well, I mean, actually.
Why didn't you tell me about this patient?
I meant to. I'm sorry.
Okay.
I'm sorry. The medicine resident paged me, and I meant to page you, and but I know, and it looks really bad. I want to show you the patient.
You should have told me about this patient already, Mariah. Mariah, I want you to go get the patient now, okay?
Okay. All right.
Okay.
I'm gonna get
Bring the patient down here.
Okay.
Okay.
All right.
We'll see the patient together.
Okay. All right. Thanks, Dr. Bernstein. Thank you.
No
Thanks.
problem. See you soon.
So we're just gonna take you into this room here.
Mariah, this is the reason why you should have called me earlier. This is potentially very serious. Okay. So we're gonna need the weekend resident on call. Okay. We're gonna need the neuro resident.
Okay.
Do you know how to get a hold of these people?
It's Christy. Christy? Christy! I think Christy.
Page her.
Oh, okay.
Page her.
All right. Christy?
We talked about professionalism. Page her. Don't be yelling for her. Christy, nice to see you. So you're the chief?
Yes, I'm the chief, Dr. Bernstein.
Who's on retina?
I think it's Vinay.
Paige Vinay.
Vinay? Oh.
Paige Vinay. We talked about this. Hi, Vinay. How are you?
Good, Dr. Bernstein.
I know it's 12 p.m. I know it's 12 a.m. Okay, on a Saturday. Well, Sunday morning. Okay, but this is very important. I want everybody to see this.
Right. I have nothing better to do than to be here with you.
Good.
Saturday at 12.
Who's on neuro? Who's on neuro?
I think it's Danny Kim.
Can we page Danny Kim?
Sure.
Danny? Oh, sorry.
No, Mariah, go ahead and yell. He's here already. Go ahead and yell for him.
Danny?
So again, this is something we don't see very often. So we need to have the whole team here. We want to get as many residents here as possible to see this. Okay, and it's very late, but residency is most important. Okay, so we have almost everybody here, but who's the VA chief? We also want to get him here or her. Does anybody know who the VA chief is?
I think it's Ross, but I don't see the reason why he has to be here too.
Because he needs to see this, Christy.
Okay.
All right, I'll page him.
Nice of you to join us, Ross. We just really wanted you to see this. This patient's also a veteran.
Yeah.
So that's why we wanted you here from the VA. Who's the first year at the VA on call this weekend?
I think it's Aiden.
Okay. You know what? Why don't you page Aiden? Because we actually might need to admit this patient. Yeah, this is pretty serious. We might have to admit it.
You know, Dr. Bernstein, we were in the middle of a case. I have Aiden take.
I don't care. Welcome.
Yo.
Aiden.
Hey, Dr. B. What's up?
How are you?
Oh, hey. I was sleeping, but
Were you biking?
Yeah, we did. I did a couple miles.
So did I.
Yeah.
Yeah, I biked 10 today.
Oh, good. Yeah.
So we might have to admit this patient. That's why we wanted you to come in. Okay.
Okay.
Are you chewing gum, Aiden?
Yeah. I mean, I was drinking coffee. I didn't want to.
Okay, it's not professional. I want you to.
Are you chewing gum?
It doesn't matter what I'm doing, but no, I'm not.
Oh.
I'm exercising my masseter muscle. Okay.
I'll stop.
Everybody get closer. I want everybody to see this very close. Closer. Come on, everybody get closer. Closer. Everybody get closer. Come on, closer. I want everybody to see this. You can't see it from back there. Have you ever hunted before? Get your hooves away from your face. Get your hooves away from your face. Everybody get closer. I want everybody closer. Closer, okay? Get closer. I want you to see this. Touch the patient. Get closer.
Dr. Bernstein, one thing, being a patient, I just don't understand why there are so many doctors here.
These are all my residents, so they're here to learn. Do you have a problem with them being in the room?
No, I don't have a problem with it.
Okay.
I just have that question.
Furthermore, I was recently just nominated as one of Cleveland's top doctors. That's probably why you're seeing me.
Yes, I think so.
Okay. Have you not seen the newest edition? Page 113. I'll show you this here.
Well, that's wonderful. Great. I feel much better now.
Good. Christy,
Yes.
I need you to call Dr. Coffey.
Now?
Yes, right now,
It's
Christy.
pretty late.
I want you to call him now.
Okay, I'll page him.
Dr. Bernstein, would you like the hotel?
So I'd like a hotel.
Okay, I'll be back.
And I want a B test done. Is Debbie here?
B test, I got it.
Okay. I want a PET scan.
I got it.
I take offense to that.
Okay.
You want me to call Debbie at home? Wake her up?
Yes, we need a tech here. Okay.
What should I do, Dr. Barnes?
What should you do, Ross? We're definitely going to need you here, so don't go far.
Do you want a B scan?
Yes, let's do a B scan. Yes. So I'm so glad that everybody can make it in here tonight. This is really a great learning experience. Okay. I'm just going to do a real quick test here, okay? I just need you to stare straight ahead. Do I have a scribe? Debbie's not here yet. Do I have a scribe to write this down?
Yes, Dr. Barnes.
Okay. This might touch your eyes. Just keep your eyes open. We've got 14.2 DSB units on the left. And 19 DSB units on the right.
Okay, I got that.
Get that down?
Mm-hmm, we got it.
At 70.
You know, Dr. Bernstein, I just don't understand. You bring, what, 1, 2, 3, 4, 5, 6 plus 7 doctors here to see me in the middle of the night, and, you know, you've done everything but ring my bell. And this is utterly ridiculous.
Well, I am the top doc, okay?
I understand, but I don't even know what my problem with my eyes.
Okay. So, as I've thought all along, you have what we call booth-thalmos, okay?
So, Dr. Bernstein, after all this workup, I don't understand what is the treatment for this.
Just relax.
I don't get it. I don't know what's going on here. What's the treatment for this?
Relax.
What am I going to do with this booth-thalmos? Okay.
We're gonna talk about it out in the hall. Christy, why are you leaning over?
Oh, sorry. Sorry, Dr. Barnes.
This is a bunch of bull.
Just relax, okay? We're gonna go talk about it out in the hall. Okay, then we'll schedule a follow-up. 3 weeks.
3 weeks.
We'll talk about the treatment then.
Okay. What am I supposed to do until then?
Relax.
GI clinic. Yeah, I have a consult. Yeah. Okay. Okay. I'll see you in a minute.
This is GI clinic.
Oh, great! You're here.
Hey, what's up?
Thanks for
Dean Johnson,
coming
nice
so
to meet
quickly.
you.
Yeah.
What's going on?
Well, we have a patient down here. You know, I don't know what's going on. They kind of said their vision isn't. You know, something's not really right. They're a little red. They've got the discharge.
What's red? The
I think they've
face,
got
the arm,
I think
the
it's a
hand?
hyphema. I think it's a hyphema.
What?
Is that? Am I saying
FEMA?
that wrong?
Like emergency disaster?
No, not like that. Something like.
What part of the body
you know,
is affected?
Like, you red eye.
Oh, red eye. You know, we get that a lot. You know, I'm actually ophthalmology.
I
don't know if
you're
we.
the eye, right?
You know what? I don't think we handle. You know what? Maybe I should just. How about we get I'll just call my chief. I think it's straight.
All right.
Yeah, I mean, I think eyes are totally gross.
Yeah, pretty.
Oh, hey, Danny, hey, what's
Hey,
up?
what's going on? How you doing?
You know, there was a.
How you doing?
I was here playing foosball.
Yeah,
and,
hey, thank you.
Hey,
for
I'm Dr.
coming.
Kim, I'm chief resident.
Yeah.
I'll call. This is my first year.
Hey.
How's it going?
You know, we have a patient with a problem down here. I think they have a hyphema.
Oh, what?
It must
What?
be herpes or something.
What did you just say?
I think it was something about FEMA.
FEMA?
Hurricane
You know,
Katrina?
like
I don't know.
you know,
I never.
the red thing
The red? What? Where?
on the face. You know, like
saying it's
above
an
the
eye
nose,
thing.
like.
It's not. Oh.
Yeah.
They get that all the time.
Hey, look. You know, I know you're trying to call, but look, I'm Dr. Kim, but see that?
I'm ophthalmology.
In that, that's not.
No,
No,
it's
it's totally different.
Totally different.
Totally different. But why don't you page 35251 and you get the right guys. All right?
All right.
All right.
Good luck.
Anywhere else? All right, thanks.